Today the topic of my video is Lysergic Acid diethylamide, LSD. The team members are
Faiza Tree,
Said Amir Hamza, Mohammed Walid Safraz and Zainab Razin. First of all, let's have a view on points which we are going to discuss in our video. These are: Introduction, History, Development, Interesting facts, Pharmacokinetics, Pharmacodynamics, Clinical potential, Adverse effects, Therapeutic indication, Toxicology. Now, start with the Introduction. LSD, abbreviation of lysergic acid diethylamide, also called Lysergic, potent synthetic hallucinogenic drug that can be derived from the ergot alkaloids. Its basic chemical structure is similar to that of the ergot alkaloids, and it is structurally related to several other drugs, e.g., bufotenine, psilocybin, harmine, and ibogaine, which can all block the action of serotonin, the indole amine transmitter of nerve impulses, in brain tissue. LSD produces marked deviations from normal behavior, probably the consequence of its ability to inhibit the action of serotonin, though the mechanism of the drug remains uncertain. LSD was used experimentally in medicine as a psychotomimetic agent to induce mental states that were believed to resemble those of actual psychotic diseases. Now, history of LSD. The ergot fungus contains a number of highly poisonous and psychoactive alkaloids, including lysergic acid, LSD, which was synthesized from the ergot fungus in 1938 by chemist Albert Hofmann. In 1938, Swiss chemist Albert Hofmann synthesized the chemical lysergic acid diethylamine while working for Sandoz Chemical. He was looking for a stimulant for blood circulation. It turned out not to be the circulatory stimulant he wanted, and so he set the formula aside for the next 5 years. In 1943, he accidentally exposed himself to this drug and noted an uninterrupted stream of fantastic pictures, extraordinary shapes with intense, kaleidoscope-like play of colors. LSD was brought to the attention of the United States in 1949 by Sandoz Laboratories because they believed LSD might have clinical applications. Then about the development of LSD. Some areas of interest and potential developments related to LSD and psychedelic research include: Therapeutic applications. There is a growing body of research exploring the therapeutic potential of LSD and other psychedelics in treating mental health disorders. Clinical trials and studies have investigated the use of LSD-assisted psychotherapy for conditions such as depression, anxiety, PTSD, and addiction. The results have shown promising outcomes, leading to renewed interest and ongoing research in this area. Psychedelic-assisted psychotherapy. LSD is being explored in the context of psychedelic-assisted psychotherapy, which involves administering a psychedelic substance in a controlled setting with the guidance of trained therapists. The therapeutic process aims to facilitate self-exploration, emotional healing, and personal growth. Ongoing research seeks to refine protocols, optimize therapeutic frameworks, and assess the long-term effects and safety of this approach. Public perception and policy. LSD and psychedelics, in general, have experienced a shift in public perception and policy in some regions. The growing body of scientific evidence supporting their therapeutic potential has contributed to discussions surrounding drug policy reform. Decriminalization and expanded access to psychedelic-assisted therapies. However, it's important to note that the legal status and regulations surrounding LSD vary significantly between countries. Here are some interesting facts about LSD. When LSD travels in your body, it takes about 20 to 60 minutes to kick the LSD. The total trip on LSD lasts between 6, 5 and 13 hours. Mind manifesting properties. LSD is often referred to as a psychedelic, or mind-manifesting, substance. It can induce profound changes in perception, cognition, and emotions, often leading to hallucinations, sensory distortions, and altered states of consciousness. Micrograms to impact. LSD is incredibly potent, with effects observed at microgram doses. A typical dose of LSD ranges from 20 to 200 micrograms, micro-G, meaning a single gram of pure LSD could potentially produce millions of doses. Quit alcohol and have LSD. Being lesser addictive than alcohol, having LSD may counter an alcoholic. However, it doesn't mean that LSD is not harmful. Rather, lesser harmful. LSD simulates serotonin and endorphins among other chemicals in the brain, which make you elated and pleasured. Synesthetic effects. LSD can induce synesthesia, a phenomenon where sensory perceptions become cross-wired, leading to experiences like seeing sounds, hearing colors, or tasting words. This blurring of sensory boundaries can result in unique and novel perceptual experiences. Influence on art and culture. LSD played a significant role in shaping art and counterculture movements. It became an emblem of the 1960s counterculture, associated with the pursuit of expanded consciousness, peace, and spiritual experiences. LSD influenced various forms of art, music, literature, and even inspired new artistic movements such as psychedelic art. Non-addictive and inexpensive. Unlike many other drugs which lead to addiction, LSD is physically a non-addictive drug. LSD is so powerful that only a small amount produces long-lasting effects as opposed to other stimulants. Therefore, if measured in the extent of its effects, LSD is comparatively a cheaper drug. Let us discuss about pharmacokinetics of LSD. The pharmacokinetics of LSD were not properly determined until 2015, which is not surprising for a drug with the kind of low μg potency that LSD possesses. Absorption. LSD is most commonly administered orally in the form of tablets, capsules, or blotter paper, tabs. It can also be taken sublingually, placed under the tongue, or less commonly through intramuscular or intravenous injection. When taken orally, LSD is rapidly absorbed from the gastrointestinal tract. Distribution. Once absorbed, LSD is distributed throughout the body, including the brain. It readily crosses the blood-brain barrier due to its lipophilic, fat-soluble nature. The exact distribution pattern and binding affinity of LSD to specific receptors in the brain contribute to its hallucinogenic effects. Metabolism. LSD undergoes hepatic metabolism, primarily by the enzyme cytochrome P452D6, CYP2D6. The major metabolite of LSD is 2-oxo-3-hydroxy-LSD, which is formed through oxidation and hydroxylation. However, the metabolism of LSD is relatively complex, and other metabolites can be produced as well. Elimination. The elimination half-life of LSD is relatively short, ranging from 2 to 4 hours. This means that it takes approximately that amount of time for the concentration of LSD in the bloodstream to reduce by half. However, LSD's effects can last much longer due to its potent pharmacological activity and the influence of psychological factors. Urinary excretion. After metabolism, LSD and its metabolites are primarily excreted in the urine. Detectable levels of LSD and its metabolites can be found in urine for up to 2 to 4 days after ingestion, depending on factors such as the dose, individual metabolism, and testing methods. Pharmacodynamics. The pharmacodynamics of lysergic acid diethylamide, LSD, refers to how the drug interacts with receptors and produces its effects in the body. Serotonin receptors. LSD primarily acts as a potent partial agonist at serotonin receptors, particularly the 5-HT2A subtype. It binds to these receptors and modulates serotonin signaling in the brain. This interaction is thought to be the main mechanism responsible for the hallucinogenic effects of LSD. Glutamate system. LSD affects the glutamate system, particularly by modulating the activity of N-methyl-D aspartate, NMDA, receptors. It enhances glutamate release and influences glutamate receptor function, which may contribute to the altered sensory and cognitive experiences associated with LSD use. Dopamine system. LSD indirectly affects the dopamine system by altering serotonin-dopamine interactions. It modulates dopamine release and transmission in certain brain regions, including the prefrontal cortex and the striatum. These effects may contribute to the psychedelic experience and the reported sense of enhanced mood and altered perception. Default mode network, DMN. LSD disrupts the functioning of the brain's default mode network, which is associated with self-reflection, introspection, and mind-wandering. This disruption is thought to contribute to the altered sense of self, ego dissolution, and mystical experiences reported by some users. Other receptor targets. In addition to serotonin, LSD can interact with other receptor systems, including adrenergic, dopaminergic, and histaminergic receptors. However, the significance of these interactions in mediating the effects of LSD is not fully understood and requires further research. Let us know about clinical potential of LSD. While LSD, lysergic acid diethylamide, has a complex legal and regulatory status that limits its current clinical use, there is growing interest in exploring its potential therapeutic applications. Research in recent years has started to shed light on the clinical potential of LSD in various areas. Mental health disorders. LSD has shown promise in the treatment of certain mental health conditions. Early studies and anecdotal reports suggest that it may have therapeutic effects in conditions like treatment-resistant depression, anxiety disorders, and post-traumatic stress disorder, PTSD. LSD's ability to induce altered states of consciousness and promote introspection may help individuals gain new perspectives and process traumatic experiences. End-of-life anxiety and existential distress. LSD has been investigated as a means to alleviate existential anxiety and distress in individuals facing life-threatening illnesses. The drug's ability to induce mystical-type experiences and foster a sense of interconnectedness and transcendence may help individuals come to terms with mortality and find meaning in their experiences. Pain and palliative care. Some studies explored the use of LSD in managing chronic pain and enhancing the quality of life for terminally ill patients. The drug was believed to help patients transcend their physical suffering and alleviate psychological distress associated with severe illness. Cluster headaches. LSD has been investigated for its potential to alleviate cluster headache. An extremely painful condition, some individuals have reported experiencing a reduction in the frequency and intensity of cluster headache attacks after using LSD. However, further research is needed to establish its effectiveness and safety in this specific application. Adverse effects. LSD can also produce various physical effects. Dilated pupils, increased heart rate, blood pressure, sweating, dizziness, tremors, increased body temperature, appetite suppression, sleep disturbances, dry mouth, nausea and gastrointestinal discomfort. Therapeutic indication. It is in early stage preclinical and clinical trials for depression, anxiety, addiction, cluster headaches, Alzheimer's disease, Tourette's syndrome. Now at the end, the toxicology of LSD. LSD is known for its hallucinogenic effects, and its acute toxicity is generally low. However, the use of LSD can lead to a range of psychological and physiological effects, including psychological effects. Altered perception of reality, including visual hallucinations and synesthesia. Distorted sense of time and space. Changes in mood and emotions, ranging from euphoria to anxiety or heightened sensory perception. Potential for bad trips, characterized by intense anxiety, fear, or paranoia. Physiological effects. Dilated pupils. Increased heart rate and blood pressure. Elevated body temperature. Sweating and chills. Loss of appetite. Sleep disturbances. Altered mood and emotions. LSD can induce a wide range of emotions, from euphoria and bliss to anxiety and paranoia. Emotional experiences can be intense and unpredictable. Changes in thought patterns. LSD can lead to changes in thinking, including a sense of interconnectedness or a loss of the ego. This can result in profound insights or confusion. Physical effects. LSD can cause changes in heart rate, blood pressure, and body temperature. Dilated pupils, increased perspiration, and tremors or trembles are also possible. Anxiety and panic reactions. Some individuals may experience anxiety, panic, or a sense of impending doom during an LSD. It's important to note that the effects of LSD are dose-dependent, and a high dose can lead to more intense and potentially distressing experiences. Additionally, the effects of LSD can last for several hours, typically around 8 to 12 hours, and may have residual effects for up to 24 hours or longer. Hope so you have found it informative. Thank you so much. Jazak Allah.